Hello everybody, I'm Don Counts. Welcome to Fayetteville Public Utilities Channel 6 and all the folks listening on radio and Facebook and YouTube. We want to do an update with the city of Fayetteville, and Britt and I are here with them, and we're going to support them to talk to them about what's all going on. Today we've got Christy Gentry here. We've got Michael Wissenath, the mayor of Fayetteville, Jessica Sis of the Fayetteville Police Department, and Britt Dye, our CEO, general manager, on the other end. First of all, we're going to go right into the mayor and give us an update on what's going on at the city of Fayetteville.
Well, thank you. I want to thank FPU for coming and calling me yesterday and bringing forth this idea. Mayor Newman and I have been in consultation daily. I've also been in consultation with our city administrator, Scott Collins. This has been a fast and fluid situation since going on 7 days now. I'd say last Friday was when, not from a local state, and a national level, there's just been a lot of information coming down from the federal level, from CDC, and advisement and restrictions. And of course, these restrictions are only to do what's best. We're going off the models of maybe some things that didn't work in some other countries, or maybe like I use Italy as an example. Maybe they weren't quick enough on the social distancing and everything. So we're following every protocol that's standard. Statewide, nationally, and we're not trying to restrict anybody from doing anything, but we're trying to be safe and healthy. And you hear the term flattening the curve on this situation. We've been fortunate. On Wednesday of this week, Mayor Newman and I participated in a conference call with the governor. All the mayors of all the counties and the cities participated. This was a very informative, meant to be an upbeat, which was Governor Lee came to us as the elected leaders of our communities to say, look, we can do this, we're Tennesseans, we're made for this. At the same time, setting up the communication links so that we're informed on a daily basis. And he's been having press conferences every day. And I want to state that if for everybody that's listening, if you go to www.tn.gov/governor. There's a lot of information on this Corona COVID-19 situation at the moment. There's information about where we stand. One important piece of legislation that has been moving through the House and the Senate at the state level right now is a situation that under this current situation that elective bodies can meet through conference call or teleconferencing or other means that don't necessarily constitute a standard physical quorum to do the business of those bodies. It hasn't fully passed. I think it came out of the House yesterday, which means it'll go through the Senate. Also, the governor has said that they have expedited, I think, trying to wrap up the budget. They're normally in session at the state level until about late April, early May. But what they're trying to do now is, and they've been working 24/7. I give everybody, all of our representatives, Representative Pat Marsh and Representative Tillis and Senator Shane Reeves, and everybody there's representing all their cities and counties, that the legislature is trying to do the best. The governor had originally put into the annual budget $100 million for grants to go to communities within the next year. He's doubled that to $200 million. That information is on where that link I mentioned. Also, there's going to be a link about to the SBA, the Small Business Administration, for small businesses. So at the moment, the way we are locally, we've limited access to our city buildings, meaning it's best, like if you need to go to the municipal building to pay your bills or taxes, it's best to call 433-6154 first. And talk to the ladies in the office about the best way. Of course, with our website, you can do electronic payments. And then also our recreation center is closed from an access standpoint. Now, I did see an email to me that they're still doing some sign-ups. We've postponed all our Little League, baseball, softball. The soccer has been pushed back at this moment till April. But this is a fluid, hourly situation now. And I know that going back to the governor, he's on conference calls with the president and the vice president at some point on a daily basis. Mm-hmm. So things are coming fast and fluid. The best thing I'd like to say is for everybody to continue to support our small businesses, because at this moment, our fast food restaurants and our local restaurants, they're open at the minimum drive-through. Some may not let you dine in, but you can drive through. Supporting them is critical at this moment. At our meeting schedule for April for the Board of Mayor and Aldermen, I've been in constant contact with Scott Collins about streamlining some things, because we normally have committees and things. So we're trying to do some different things, but that's still a week and a half away, so that may change as well. But we're doing the best we can. I wanted to bring Commander Casillas and Ms. Gentry along, because there are things that people do on a daily basis. They would normally access the police building, or they would access our building for planning codes, contractors bringing drawings and designs. So I wanted them to come and speak on the best way to communicate with them as well.
Okay. Well, we appreciate y'all coming. There's a lot of information. Britt, as he just mentioned, we're in a fluid situation too. We know what we're doing today, but we're not sure what tomorrow's going to bring.
That's correct, Don. And we already had 2 employee meetings this morning with the smaller groups getting together, and then we got one more meeting with the last group of employees. And which Monday we're going to start a staggering shift, and where everybody's not together at one time in case somebody does get sick. But our lobbies are still open at this time, but in the middle of next week they might be closed. But if you got symptoms or been exposed, we appreciate you not coming in the building, and we're going to post signs on the doors, to remind you of doing that, or call us. But we got advertisements going out as of yesterday on several different ways to make the payments, and we even opened up the door more, for that. So we could change it any time. Who knows?
Absolutely. We'll talk about some of those payment options and also some of the other things we want to get the word out here in just a minute. Christy Gentry, Planning and Codes. Tell us what's going on in your department.
Yes, sir. Well, we're trying to do as much business as normal, doing phone calls and emails more than anything, but we are still issuing permits and doing inspections at this time. We are not allowing people inside the building, but if they need to come and pick up a permit, we're kind of doing curbside service and sanitizing when we come back in the building. But if you need our office or have questions, 433-2565, and we'll be happy to help you.
And that goes for all the other departments inside there, not just Planning and Codes,
yes.
Correct? Okay. All right. Very good. Jesse, I'm sure y'all are always busy. You might talk about how y'all are operating.
It's going to be basically the same thing that y'all are doing. We're going to be housing in place and having people call in, 438-7771 as well. You can call up there and the secretaries will guide you the direction that to see fit with whatever that you may need. Like accident report, try to go through your insurance company and have them call up and request an accident report, and it's a lot easier for us to fax that to them instead of you coming in there and exposing the officers or the building, contaminating it. But right now, everybody, let's try to work on going by emails and calling in and asking what they need to do or how they can get it. It'd be a lot easier for us to to resolve everything.
What's the protocol for your officers one-on-one with people?
Please be patient with the officers and don't get upset with them if they don't shake your hand, because we're having them keep within the CDC and the Tennessee Health guidelines to what they say that will keep us from contracting the virus. So if they're staying 6 foot from you, they're not trying to be hateful. They're just trying to limit themselves to the exposure. But we're going to continue as we do. We're going to continue to patrol, and like we normally do. We're trying to do most of the calls by phone, of course, but we're going to keep on moving forward as we've been doing.
Sounds very good. Mayor, what's the situation with the fire department? How are they handling things?
I would say one thing interesting about the fire department for our local businesses, this is about the time of the year that they're doing annual inspections. I know at G Squared where I work, they called the other day, so you're probably going to get a phone call from them first, getting all the emergency contact information, the normal information. Then that's limiting the time they actually have to come and physically be in the building. So that's, I think, the main interest. Of course, a lot of times their buildings are not the general public isn't just walking in and out. But all of our city services are still functioning. Public works, I mean, on the same schedule, the same pickup, the same collection. You know, we don't have a situation where we have a certain number of employees out. Anything can change, and we will adapt as we can. I want to thank FPU as well, because what most people don't realize is, let's say a stay-at-home order comes down from the governor or the national level. I mean, there's certain services have to run. I mean, our grocery stores have to be full, and I really want to harp on the fact about the not hoarding. I mean, our stores are changing hours. They're changing hours to let the elderly come earlier and get in there. But and the supply chain, from my understanding, you know, these are going to be catching up soon. But there's no reason to go buy 5 or 6 rolls of toilet paper if you need one. If you go to Gerald's, a lot of times their meat's fresh. That meat's going to last 1 or 2, 3 days. That's the way they make it to be the freshest it can be. So keep in mind, I also want to state that I've noticed a lot of our local, for the ones that have a local church, your church is already involved in doing things from a volunteer basis, getting communication out if we need to get some of these items from the stores to the elderly that need to stay in to lessen their getting the potential of being exposed or contaminated. So, and I've seen some networking between these organizations of local volunteers. So we're going to have a big volunteer effort going forward. That's always been one of the strengths of Lincoln County and the state of Tennessee. So there's a lot of information to digest, and all of us at the table are keeping up on this, you know, a majority of the day. And with Ms. Gentry, you know, in her department, they deal with the calls about if somebody's grass is too high or somebody's neighbor's got too much garbage in or something. I want people to understand this situation right now is the #1 situation. Those situations aren't, they're going to have to be lower priority. Doesn't mean they're not important, but they're just going to have to be lower priority at the moment.
Well, Britt, we are also limiting going in houses as well. You might mention that.
That's great. No more telecom installations. You know, today's the last day. Any new installs, or if we get inquiries about installing, we'll start that back up as soon as we can. But we're trying to keep the traffic down from our employees going inside the customer's house. Like if it's a pilot light, you know, we respond about anything. If it's a remote not working or a box that's gone bad or something, but call in. We try to handle the situation all off from the dispatch. We're still going 24/7, and the remote disconnects and things like that, we have seized that to some degree. We're going to work on them with the customers on a case-by-case basis, and you know, we're going to survive this. It's another challenge, as the mayor was saying, and we'll make do and we'll survive it.
Mayor, we are moving forward in the city and the county and trying our best to get the word out as much as we can. And as you know, we're here to get that word out for you anyway. Anytime we can do that for you. Is there anything that you really want to tell the public one more time before we wrap up?
I would say check our Facebook page, check the FayettevilleTN.com website. Our city Facebook page is probably going to have the quickest, fastest information. I know from my Facebook page, I share a lot of information as it comes forward from different groups and different things. And everybody just be aware, do the social distancing, keep up with the national news, be optimistic. It can be real easy to be pessimistic, but I mean, this isn't the first time our nation has faced certain things like this. We will get through it. Right now, we're just trying to, you know, they're just trying to mitigate the best they can. And so stay hopeful, be involved, help out when you can. Help your neighbor when you can, and be supportive of our people at FPU and our city workers, and be, you know, mindful of the fact that, you know, they're taking a chance every day when they come to work, that other people some people have the ability that they can stay home, and that's great. But for the rest of us, you know, we're on the ground, we're working this thing hourly and daily, and So, and we'll just keep giving information out as soon as we can get it.
Let's say something about Eddie Plunkett and his group. The trash has got to be picked up. That's another thing I'm sure they're being more careful about, and that kind of thing. And probably there's more trash too, probably.
Well, at the moment, everything, as I mentioned, those services are still running as normal. As far as like if you have stuff you put on the curb, that runs the same day they pick up your trash. If there's any difference in service, if there's anything from let's say we get a situation where employees are down or we start staggering shifts, we will immediately let the public know how that affects, because the last thing we need is more trash out there or more things that could help make a worse situation from a health standpoint.
Brett, let's talk about flushable wipes. We have a lot of those, and a little bit more probably now that everybody's doing a little bit more cleaning. What's our word from the sewer standpoint on that?
Well, from the sewer standpoint on the flushable, they have flushable wipes, but they're not actually flushable. They'll clear the toilet bowl, but it still gets stopped up into the sewer line. So any type wipe like that, if it don't disintegrate or something, if it hits the water or tear up in little pieces, we're going to have trouble down the line. And right now with with this virus going on, we don't need to be having backed up sewers. And anybody that can help us on that, just put them in the trash can instead of trying to flush them down the sewer lines, because eventually it will get stopped up, because it's not just the flushable by itself. It gets mixed in with like grease and those kinds of things, and that's what forms the hardness in the sewer line that stops them up. So then we'll start having overflow problems, and at this point in time, like I said, we don't need any of that during this time.
Just paper, no wipes.
That's correct.
All right. Christy, anything else that you want to cover?
Just please be patient with our employees and respect our decisions that we make. We're having to postpone some of our meetings, and we're going to try to get business done as normal, but it may be pushed back a week or so. But we'll keep the public updated, so just continuously check our website.
Mayor, we're trying to protect not only our employees, but the public as well.
That's exactly right. I mean, we're in a situation, as I mentioned earlier, about flattening the curve. I would say that, as I mentioned earlier, Italy is, I think, the best example of a country that, with China, that was like a 4 or 5 month process to get to now. With Italy, it's only been a few weeks. And my wife has a good friend over there that corresponding back and forth can confirm that everything you're seeing on TV is true. I mean, they're in a true crisis. We're trying to prevent a situation locally and statewide and nationwide of preventing our hospital and our healthcare services being overrun into capacity. And I will state that yesterday morning, our local health department, you may hear the governor refer to public clinics in each county. Well, our health department would be our public clinic. So yesterday morning between 8 and 10, they started doing some testing. The tests are still, slowly getting out to each of the communities. And when they run out there, I actually be patient with our health department and our healthcare services, because the people that are identified to take the test are going to be the ones with the worst symptoms, the most aggressive symptoms. And so they were triaging in the parking lot. And everything, I went to my local healthcare provider recently just for a follow-up the other day. Most of your doctors, they want you to call ahead. If you feel like you have these 3 main symptoms, they really want you to call ahead. They may give you a different number. You have to be patient with the testing too, because there's only so many kits. But the governor and his team, and President Trump mentioned this in a press conference the other day, there's been some things done from a legislative standpoint for the national and the local and the state level recently to open the lanes on acquisition. So I read this morning that the state, now has hundreds of ventilators, and they're trying to increase that number as much as they can on a daily basis. But with anything, products are limited, and everybody at this moment in the industry is trying to catch up. So it's really it's not a perfect process at the moment, and it's not going to be for a little while. So there's going to need to be some patience as well. But for the main part, if you feel like you have these main symptoms, then you need to call your healthcare provider. Our Tennessee Department, our local health department here is 433-3231. And so you can call them and see what the status of, and I know the governor will probably have another press conference today as well, but it's just a very fluid, hourly situation.
Very good. I feel like we're ahead of the game right now. We hope we stay ahead of the game, but for sure, because it's a very serious situation worldwide. But we thank you for what you're doing, and thank you for getting the word out. Jesse, anything else that you need to reiterate?
Just continue looking at our website for updates. If we don't have them there, look at the Fayetteville City website, and we'll try to update you on things you can do or where to find things.
And your number over there
It's
is?
going to be area code 931-438-7771.
Okay. The mayor and the city's number?
433-6154 is the main number.
All right. Britt, anything before we go?
We're as well keeping everything posted and updated on our website. I challenged the marketing department this morning, our social media, which they're all three in this room right now, getting that video out there that's talking about a little ray of sunshine, and bring a smile on everybody's face, play the music, listen to it, because it could be worse. But again, it's a challenge, and I'm sure that it's like the mayor said, we're Tennesseans, and we're going to meet the challenge.
Our number here is 433-1522. Call us ahead. That's really what we want to do, really, right, Britt?
That is correct.
Call as much as you can and try to handle everything we can on the phone or outside some way or another.
I guess one thing Mr. Dye mentioned, the wipes. Since more people are cooking at home the last week, I would say grease would be another situation you want to address too, about not just pouring it down the sink.
That is correct.
Because over the years, and I've been on the FP board for years, and Mr. Dye is very good about showing us the effects over time, and we just spent millions of dollars over the last few years, redoing some of these sewer lines, and you can these lines can be wrecked pretty quickly.
It takes no time at all for the grease, and it's a liquid, and you actually see through it by the time you pour it down the drain or whatever. But by the time it gets in that sewer line, then it crystallizes, turns white, gets hard like a brick, and those kinds of things. And that's what messes up our pumps and all those kinds of things. But, if everybody take caution and do the right thing, and we're 50% complete on the sewer side right now, and we want to get 100% complete and replaced, but come a long ways. But as the mayor says, we spend a lot of money.
Please don't put grease down the drain anywhere, even in septic tanks. You don't want to do that because it's going to cause you problems down the road.
That is correct.
All right. Thank y'all very much.
Thank you.
And we've had Christy Gentry here. We've had the mayor, Michael Wissenat. We've had Jessica Sisk, and then we've had our CEO, General Manager Britt Dye here. We appreciate you watching, and we'll have more updates as needed. And we appreciate all the folks listening on the radio and on Facebook, YouTube, and Channel 6.